Blood supply of the face mainly comes from the facial artery. Facial artery is a branch of, this is facial artery here, you can see this, its tortuous artery is facial artery. This facial artery is a branch of external carotid artery, just at the, just above the greater cornu of the hyoid bone. This is hyoid bone. We have got facial artery. Then facial artery, it moves anteriorly, and then between the submandibular gland and the mandible, just on the inferior border of the mandible anterior to the masseter muscle, which is not shown here, which I will be showing in the next slide. So this tortuous artery is facial artery. It is moves upward along, on the lateral side of the buccinator muscle, then beneath the zygomaticus major and minor muscles. Then it enters the lateral side of the maxilla, then lateral side of the nose, and here it is anastomosing. It becomes angular artery because here it reaches the angle of the eye, medial angle of the eye or medial canthus. So here you can see it is anastomosing with the dorsal nasal branch of the, ophthalmic artery. So dorsal nasal branch of the, because it is supplying the dorsum of the nose, dorsal nasal branch of the ophthalmic artery anastomose with the, you know facial artery, and it also anastomoses. So these dorsal nasal branch, supratrochlear, supraorbital, these are arteries, are the branches of the internal carotid artery. So in actual there is anastomosis being taking place between the branches of the external carotid artery, as facial artery is a branch of external carotid artery. Then these branches, which is dorsal nasal branch, supraorbital, supratrochlear, as these are the branches of internal carotid artery. So this is the very important point here. Actually, anastomosis is taking place between the branches of the internal carotid and external carotid. And branches of the, further branches of the, facial artery, this is superior labial branch, this is inferior labial branch, and these branches, they anastomose with the arteries of the same name, of the from the other side, from the other facial artery. So here you are looking at transverse facial artery, which I will be discussing in another. So look at this thing. This is transverse facial artery. Transverse facial artery is a branch of this superficial temporal. This is external carotid. It terminates into two branches. The smaller one superficial temporal here, and the greater one is maxillary artery. Maxillary and superficial temporal are terminal branches of the external carotid here. And this transverse facial artery, which is just only small part of it's being shown because the rest of this artery is been cut, just. So this is transverse facial artery. It is actually a branch of superficial temporal artery. So here you can see this is transverse facial artery. This is parotid gland. Within the substance of parotid gland, this transverse facial artery arises from the superficial temporal here. Then it supplies the parotid gland, and this is green one is the parotid duct. So this transverse facial artery also supplies the parotid duct. And this is the magnified view of the transverse facial artery. So this is the transverse facial artery when it moves anteriorly just below the zygomatic arch, and then it anastomoses with the facial artery here. These smaller ones are the alar branches of the facial artery. So look at the facial artery, its course is tortuous, it's not straight. So during chewing or mastication or talking, while talking, when mandibles drops down, so this tortuosity unwinds, just avoiding the overstretching of this facial artery. So look at this facial artery, it passes beneath the zygomaticus major, zygomaticus minor, Then this levator labii superioris. So this artery is passing under these muscles. So these muscles have been cut just to show the pathway of the facial artery beneath these muscles. So again, this is superior labial artery, inferior labial artery. So this is anterior view. This is upper lip. This is lower lip. Upper lid. This is lower lid of the eye, and these are supratrochlear and supraorbital arteries, and this is angular artery, a terminal part of the facial artery anastomosing with these arteries. So it is actually anastomosis between internal carotid artery branches and external carotid artery branches. And beside that, this maxillary artery, it has got branch which is called inferior alveolar. Here it comes. This inferior alveolar actually passes through a canal within the mandible. Here you can see, and in a phantom view here you can see inferior alveolar passing through the mandible, and at the mental foramen it comes out of that foramen and supplies the skin and anastomoses with the inferior labial branch of the facial artery. So as we have seen that there are many anastomoses of the facial artery. So this is masseter muscle. Just you can palpate this facial artery just anterior to this masseter muscle because it is subcutaneous here. You can palpate it, or you can check. The anesthetist uses its pulsation. So this is also called anesthetist artery. So this was a bit review about the facial artery. In next videos, I will be discussing, other arteries as well. Thank you very much.